Today, I'm going to talk about schizophrenia, one of the most complex and misunderstood mental disorders. Schizophrenia is a chronic psychotic disorder that is known to affect approximately 24 million people worldwide. Its lifetime prevalence is around 1%. However, the disorder has a significant impact on individuals, families, and communities. Symptoms usually start in late adolescence or early adulthood between age 16 and 30, regularly interrupting school, work, and relationships. Schizophrenia, despite common misconceptions, is not multiple personalities. Instead, it influences one's thinking, perception of reality, feelings, and the way in which a person relates with other people. With proper treatment, many people with schizophrenia can manage symptoms and lead meaningful, productive lives. The term schizophrenia was first introduced by Swiss psychiatrist Eugen Bleuler in 1908. The name means split mind because it refers to a disruption between thoughts, emotions, and behaviors rather than multiple personalities. The disorder has three broad symptom categories: positive symptoms that add abnormal experiences, such as hallucinations and delusions; negative symptoms, which included loss of normal emotional or social functioning; and cognitive symptoms, which affect memory, attention, and problem solving. In many cases, these symptoms severely interfere with job placement, staying in school, or forming healthy relationships. Clinicians need to understand these symptoms categories in order to design an appropriate treatment plan based on the individual's needs. The DSM 5 TR sets several diagnostic criteria for schizophrenia. A person must experience at least two major symptoms for 1 month, and at least one must involve delusions, hallucinations, or disorganized speech. Some of the other symptoms are grossly disorganized behavior and negative symptoms like reduced emotional expression or lack of motivation. Aside from these, the disorder has to substantially interfere with the functioning of everyday life, such as work, school, relationships, or self care. Clinicians also rule out other medical conditions and substance use before diagnosing. Given that schizophrenia has symptoms similar to those seen in many other disorders, careful evaluation is key to an accurate diagnosis. Delusions are unwavering false beliefs that persist despite clear evidence to the contrary. Schizophrenia involves several different types of delusions. Persecutorial delusions include imagining people are trying to harm or monitor the individual. Grandiose delusions involve exaggerated beliefs about one's own importance or abilities, which are not based in reality. Those who experience referential delusions believe that TV shows, songs, or conversations are specifically targeting them. Religious illusions involve false beliefs about receiving divine powers or special messages from God. Somatic delusions are false beliefs about the body, and control delusions involve thinking and external forces dominate your thoughts or behavior. Such beliefs seem perfectly real to the person experiencing them. Hallucinations involve perceiving things that are not actually present. Auditory hallucinations are by far the most common type, and they feature voices that comment, criticize, or give orders. Visual hallucinations involve seeing people or objects that do not exist. Tactile hallucinations cause one to have the sensation that insects are crawling on the skin or feeling a touch when nothing exists. These experiences are not imaginary for the person, they are perceived as real. Hallucinations are scary and disruptive, and it's difficult to differentiate between real and fake. This is one of the key issues, thus, why early diagnosis and treatment is so critical. Schizophrenia is an identifiable disorder with clearly defined functional differences in many brains. One brain region that is especially affected is the prefrontal cortex, a major component of executive functioning. The executive functions consist of planning, decision making, working memory, attention, and self control. People with schizophrenia typically have deficits in these cognitive tasks that make their daily life much more difficulty. Cognitive psychology helps us understand how such deficits disrupt things like employment, education, and independent living. Understanding these neurological changes also helps reduce stigma by highlighting that schizophrenia is a biological brain disorder, not simply poor decisions or a lack of motivation. Schizophrenia, scientists know, occurs as a result of various biological and environmental factors. One major biological factor is dopamine, a neurotransmitter linked to motivation, reward, and communication between brain cells. Excessive activity of dopamine at some pathways connected to the brain leads to positive symptoms such as hallucinations and delusions. People with family members who have schizophrenia have higher rates of disease and higher risk of developing the disorder than people who do not suffer from any such disorder at all. Studies of the brain scans reveal distinct structural and functional differences that reinforce this notion of schizophrenia as a disease of the nervous system, not as a character flaw or individual weakness. Schizophrenia is incurable at present, but treatment can radically enhance quality of life. The most effective treatment is still antipsychotic medications, as they help mitigate hallucinations and delusions through the regulation of dopamine activity. Cognitive behavioral therapy teaches them to identify and challenge destructive thinking and to replace unhealthy coping mechanisms with healthier ones. Family psychoeducation provides loved ones with understanding of how they can be part of the recovery process to help lower stress in the home. Community-based support services also offer vocational training, housing help, case management, and social skills training. Studies are clear. Combining medication and psychosocial interventions yields the best long-term results. Schizophrenia is not just about the symptoms. Individuals are often stigmatized, suffer discrimination and social isolation, which makes recovery that much more challenging. People with cognitive impairments and misunderstanding may also face difficulty in finding and retaining jobs. Family members are often subjected to emotional, financial, and physical stress while working as caregivers. Family support, however, greatly enhances both treatment and adherence to the outcome more generally. Education helps families understand the illness better and lessens frustration and caregiver burnout. Recovery is possible, and many people with schizophrenia go on to have successful careers, relationships, and meaningful lives with the right treatment and support. As a conclusion, schizophrenia is a complex disorder that impacts biological, psychological, and environmental factors. Early identification and intervention greatly enhance long-term prognosis, so timely diagnosis is key. Brain research is now making clear that schizophrenia is not a failing at human functions, but a medical condition, one whose symptoms can be recognized through cognitive alterations. Treatment is effective only when the individual uses medication, therapy, family services, and community resources together. Finally, the best thing we can do is to replace stigma with understanding and empathy. Educate yourself as much as possible on schizophrenia and be a model to others who are affected by this disease to help you understand it. Thanks for listening.